There's a bill before the House right now called, it's Medicare for All, but it's HR 676. And I guess the simplest way to talk about it is that it basically expands what is currently Medicare, but it increases the eligibility to everyone, to make sure that everyone has access to basic health care services. I'm a co-sponsor of this legislation. I believe in principle that we have to provide this basic level of health care to all people, supporting universal health care. There are some parts of the bill, frankly, that I think could be improved. I think we've got to talk about how these bills are paid for. We've got to make sure that Medicare is actually enabled and empowered to negotiate with prescription drug companies, which currently Medicare is not. And again, we've got to make sure that that access, not to insurance, but to health care exists. And there is a difference. And when you listen to some of the debate that's happening in Washington, a lot of people may say, oh, of course I support access to coverage for everyone. But when you ask, what does coverage mean? How you may define coverage may be very different than someone else. And this has been one of the most painful things that I've seen with the Affordable Care Act, which has done a lot of good in many ways, but what has been concerning in some other ways is that some people who think that they have health care coverage, when they actually need it, they go in and see that they've got a $10,000 or $15,000 deductible. That's not coverage, especially for people who may have been uninsured, who couldn't afford health care in the first place. So we have an opportunity as a country, as they're looking at health care, as they're talking about repealing and replacing, let's replace it with something that is truly a health care bill for the people, that cuts the insurance companies and the pharmaceutical companies out of the drafting of the bill, which we have seen. Unfortunately, we saw this with the Affordable Care Act. We definitely saw this with the Republicans' American Health Care Act that recently failed. And in both instances, those signatures ended up on the backs of people who need care the most. We've got our work cut out for us with this legislation, with continuing to see how do we improve this, how do we get feedback from our providers and folks in the community on this, and this is something that I'm looking forward to continuing to engage on.
That right